Hello and welcome to the Paducah Human Rights Raising the Standard. I'm Gary Reese. I'm the chair of the Paducah Human Rights Commission, and I have with me today as my co-host Commissioner Andrew Wiggins. And we're very honored and excited to have Ms. Kathie Hunt with us today. Ms. Kathie Hunt is with the Senior Medicare Patrol.
Yeah.
And I'm going to turn it over to you and let you kind of explain a little bit about your background, and then we'll get into some specifics about the SMP.
Okay. I am Kathie Hunt, and I have been in Paducah for about 30 years and have worked primarily in public health up until the last five years or so. I started in, actually moved here in '83 and worked in doing various things with our district health department. Was involved in home health some, and with billing and management and program development in public health. So that helped prepare me to work with Senior Medicare Patrol, and I've been doing this for about 2 years. Prior to that, I continued to work in public health, some in emergency preparedness and response. So I just brought kind of a wide variety of interest with me when I came, and am real inclined to be very much patient and consumer oriented, and want to always advocate and promote for senior health, fitness, and other activities in our community that add to quality of life for everybody in our community.
Right. Now you're located out at the Senior Citizen Center off H.C. Matthews Drive, and I want to get into just a little bit later. I want to get into a lot of the activities that are available for senior citizens there. But first, I want to get you to explain to us what the Senior Medicare Patrol is.
Okay, yeah. Senior Medicare Patrol is one of the programs of activities and programs and activities that we offer at the Senior Center. Most of them, oriented toward improving the health and well-being of seniors in our community. Senior Medicare Patrol is a national effort program that is supported by the federal government through the Department of Health and Human Services. And our primary mission is to empower seniors to and assist them and their family members to protect their personal identity, prevent stealing of that information, and to understand about healthcare fraud and other consumer scams, and to know how to report and take action if they feel like that they've been a victim of Medicare fraud and abuse.
Okay. How prevalent is this abuse, this Medicare fraud, maybe locally and maybe nationally for that matter? Can you explain that?
Yes. Medicare, let's first differentiate between Medicare fraud, abuse, and billing errors, because for the most part, what we see in our local area is abuse of the Medicare billing system, accidentally or sometimes systematically within the provider community. Primarily, though, it's billing errors. But until people learn how to detect those errors, then Medicare loses, and so does the beneficiary. So the bulk of the local Medicare fraud and abuse billing errors message is to understand your Medicare statements, understand your benefits, and know how to report those benefits and how to resolve those issues as they arise. Nationally, Medicare fraud and abuse is a major problem, and some of the national statistics indicate that up to 10% of the money that is spent by Medicare each year is actually due to fraudulent or improper billing practices. It does tend to happen in the larger cities more than it does in our area, although with telemarketers working nationwide now, our citizens are also subject to that kind of activity as well, and to end up spending money that they shouldn't have to spend, and that Medicare should not have to spend. 10% of the Medicare budget ends up being an astronomical amount of money in my mind, $60 billion. That's with a B. So that's a lot of money, and that ultimately is borne by the taxpayers, because we all pay into Medicare taxes when at working age, and sometimes afterwards through the Social Security taxing system, and then any shortfalls in effect have to be made up by taxpayers in the long run. And because Medicare works with private insurance companies and consumers ultimately suffer when Medicare fraud and abuse occurs.
Can I ask a quick follow-up there?
Sure. Uh-huh.
You talked about the impact on recipients, Medicare recipients, and how they suffer. Could you just sort of talk about how it impacts their lives when they are victims of fraud, whether it be accidental or on purpose?
Yes, and if I could, let me just cite an example. Sure. And of something that happened this winter that we've really tried to make consumers aware of. There are telemarketers who who call people and ask leading questions. Do you have pain? Well, yes, most of us have some pain, part of the time at least. But had a beneficiary who actually was talked into getting a back brace and a wrist brace. And actually that telemarketing effort is not against the law. They followed the Medicare rules. But the back brace that she got was less than high quality that it would have been had she gotten it locally. And they used a contract doctor to order the back brace. Her secondary payer, her second insurance, paid the difference. Had she not had a secondary payer and had kept the back brace, then it was billed to Medicare at $1,000 approximately. Had she not had a secondary payer and we had not taken action, she would have owed $200, which is 20% of $1,000. Medicare would have spent $800 approximately that for a back brace that probably she could purchase at a local big box store for $100. Right. and it would have fit just as well as this one. It really was not a custom brace at all. So what they did was not totally against the law, but it could have cost an unsuspecting consumer quite a lot of money, and Medicare even more money, because generally outpatient services for original Medicare beneficiaries are paid 80% by Medicare, 20% by the beneficiary or by their secondary insurance company. So we're in the process of recouping that money. I helped her and we sent the back brace back, and I had talked with her previously about discussing her case. So I won't name any names or any of that, but that's just a real concrete example of how Medicare fraud and abuse can hurt consumers in the Medicare program as
and
well.
often we're talking about people here that don't have a lot of expendable income to begin with.
That's exactly right. Many seniors live on Social Security income. Right. And that just adds to the burden. It truly does.
Now, did you have any trouble tracing that back to that telemarketer, or was that one of those phantom 1-800 numbers that are hard to track down?
It was. We actually had to call Medicare to find out who the provider was, because they talked so fast that she didn't really know who she bought it from.
Right.
And but she did have a phone number, and when the back brace came, we were able to work backwards with that. And the state office actually helped me some with that whole process. That was probably the biggest type of issue like that that I had run into. So I stayed in close contact with them. Then through our centralized national reporting system to the Office of Inspector General with Health and Human Services, then we just added to the information that they had about this particular durable medical equipment supplier. Right. So hopefully that, the noose is tightening a little on that situation. And come to find out, actually, you know how when you buy things over the telephone, if you order one order from Amazon, you might get 2 packages from 2 different places. Well, she actually had that happen too. So we had to work backwards from a couple of different directions to get that resolved, and then we reported it to Medicare. Medicare will ultimately recoup their money, and the other insurance company will as well.
Right.
But it takes some real diligence to finish and complete a project
Now,
like that.
do some of these trails, I guess you might say, they're obviously a lot of them are national, but are any of them international? In other words, overseas or?
To my knowledge, no. However, that I'm not 100% sure. Now, Medicare normally does not pay for services out of the country, but the supplier could be out of the country. And certainly the products are not all American made, because even the ones that you get through a durable medical supplier locally may not be, manufactured here.
If you don't mind, let's jump into the organizational aspect of the Senior Medicare Patrol. How is that? How are you organized? I know you're national. You mentioned that, but
we do. We have national support, and that helps because that makes resources available to us, information and training for our volunteers, for example, available to all the Senior Medicare Patrol programs across the nation. Actually, the Health and Human Services funds the Senior Medicare Patrol in every state, and then there generally, at least in most states, there's only one grantee. In Kentucky, that is Louisville Metro Health Department. Then they identify subgrantees across the state, and primarily what they've done is establish programs with the help of local organizations like the Paducah-McCracken Senior Center, so that our Senior Medicare Patrol program covers Ballard, Marshall, and Carlisle as well. Then West Kentucky Allied Services serves the southern half of the Purchase area. Pennyroyal Community Action Agency serves Lyon and Livingston and the counties that are just to our east, and all the way over to Hopkinsville. So that gives us some grassroots. We have some grassroots people, volunteers, and staff established throughout the state. Then actually Louisville Metro Health Department covers the central part of the state. There's a few organizations in the eastern part of the state. I have an 800 number. If I get a complaint from an Illinois resident or Tennessee or Missouri, I have a phone number I can call to link them up over there. There's a national, of course, hotline for Senior Medicare Patrol, as well as state offices, and then we have some local contacts, of course, with local programs. I'm not real sure who those organizations are, but we try to serve the entire nation, and I work part-time, so obviously we're spread pretty thin. Our volunteers are important. Both are highly skilled and trained volunteers, many of which are retired healthcare professionals, or people who have been involved in hospital administration, insurance, operations of one kind and another, that come in with a lot of knowledge. But we also rely a lot on our volunteers who have had just basic Medicare training, Medicare basics, and know how to make referrals to the program. They don't have to know all the minutiae. There's a lot to know about Medicare. It's quite complex, more complex in some ways than employer-based health insurance coverage, which of course just adds to the burden for seniors that have any difficulty reading or advocating for themselves, either one. So we also work with families quite a lot. But that's how we're organized in order to give ourselves, nationwide coverage.
I want to ask more about volunteers and here in just a minute, but I want to ask you, I want to jump to something else real quick. Let's suppose a senior citizen believes that he or she has been a victim of, or maybe there's some error or something like that. How would they know to contact you all? How would they know? Is that something that Medicare makes sure that they contact you all, or how does that work?
Well, Medicare, when they send out their quarterly what they call Medicare summary notice, which lets the Medicare beneficiary know which services have been billed and paid for in the previous 3 months. The information has really been improved in the last few years so that it's very apparent that if people have questions about their statement, they can call 1-800-MEDICARE, magic number, easy to remember, and report it to the Medicare customer service folks that they can reach at 1-800-MEDICARE, and that's on all the statements that they get. In addition to that, we try as SMP programs to, through a variety of ways, to let people know how to make referrals to SMP or back to Medicare. We work at health fairs and community events where we just pass out, real short and sweet information. Don't let yourself become the victim of medical identity theft. Here are the steps you should take. Learn how to read your summary notices, real little short, brief pieces of information. The other thing we do, both volunteers and paid staff, is we make presentations to groups to increase awareness, and we particularly encourage if you have an older adult church group or even a middle-aged group that you're a part of, then we'll be happy to come do a program. Actually, we really like to reach middle-aged people and have found that sometimes those community events pay the most dividend in those presentations because so many people in their midlife are helping their older parents with some of their medical care, with the details, and serving as their advocates. Wow. And then we encourage our volunteers to report, to encourage people they talk with to get in touch with Senior Medicare Patrol. And then, of course, events like this are fantastic because people see them. We do some other media activity and some public service announcements. We've done some paid radio ads in the fall. During the fall is Medicare open enrollment, and that is when people can change their Medicare plan or their Medicare prescription drug plan. By helping people understand their choices in those categories is a wonderful opportunity to also deliver our Senior Medicare Patrol message to protect, detect, and report.
So the bulk then of
word
your
of mouth.
Do I?
The bulk is really word of mouth.
Well, that's what I'm getting ready to say. The bulk of your work is getting information out there.
It is.
Because a lot of times it's the information that helps people to be vigilant.
Yes. And really the work that law enforcement, local law enforcement, the media, and others do to raise people's awareness of regular plain identity theft also helps us with Medicare identity theft. Right now, the Medicare cards still have a Social Security number on them, which if that information is either captured or wallets are stolen, that Social Security number is out there floating around, can create all kinds of problems. So that's one of the things that we always promote is protecting your personal identity, not just medical, but all your personal information from everyone.
I want to just briefly, I don't want to run out of time. I want to ask you about the Senior Citizens Center as a whole. You all are of course, part of a bigger picture there.
We are.
Can you explain some of the services that are available there to seniors?
Yes. At the Senior Center, I guess our draw primarily is our lunchtime meal program, which we offer to anyone 60 years of age or over with a small donation requested. So that helps us get people in the building. But once they're in the building, then we offer all kinds of fitness activities. That's something that we've been improving on quite a lot recently. We have a little gym upstairs. We're housed in the Parks and Recreation building there on H.C. Mathis Drive. So we have it's wonderful. I mean, we couldn't ask for a better facility. We have a full commercial kitchen downstairs and a big dining area and a community room where there's no chairs, where people can practice their ballroom dancing and their what do you call it? Line dancing. I drew a blank. Line dancing and other activities, and those are usually done on a once a week or twice a week basis. Our gym is open upstairs 8 to 4, 5 days a week. So that's some of the things we do to encourage physical activity. Some of the other regularly scheduled things that we have are a crochet club. We have where actually the pros teach the amateurs like me. Well, I haven't gotten around to crochet yet, but maybe I will. But the pros kind of teach the amateurs one-on-one, and they crochet as a group and then provide the items to the VA nursing homes and to the other nursing homes. So that it's a productive thing, you know, that they can do. We have a amateur artist painting club twice a month. We have Monday, Wednesday, Friday, we have another fitness activity, which is chair-assisted aerobics is what it amounts to. It's however much you feel like you can do. And that's a great service. And then we oftentimes have speakers around noontime. And then we have other things, you know, that kind of come and go with the season of the year. We have yard sale once a year. We have an Easter egg hunt indoors with plastic eggs, and, you know, just kind of fun activities in conjunction with our 11 to 1 o'clock activities around lunchtime.
Other than the donation you mentioned related to the meal, do community members have opportunities to donate and volunteer to your organization?
Yes. Of course, they can volunteer if they're interested in some of the minutiae related to Medicare and with helping their neighbors. They can volunteer with Senior Medicare Patrol. The Retired Senior Volunteer Program is also under our Senior Center umbrella. And that's a nationally supported program as well that links retired people who wish to volunteer with local agencies that need help. And they work in the hospitals and I think some in the nursing home as friendly visitors. They do friendly phone calls and just do things that enrich the lives of themselves and others. And right now, this week, several of the RSVP volunteers are working at the quilt show, since we're taping in late April here, and they help with that project as well. So just a variety of things that program does too.
Before we run out of time, you had mentioned that you had some tips
Yes.
that you wanted to go over with, I guess, people in general, not just seniors.
Right, people in general, not just seniors. And these are primarily tips to help people avoid medical identity theft, but as a practical matter, they're good tips for everybody, even if you feel like you have almost no medical identity because you only go to the doctor once every 5 years, whether you need to or not, like many of our
like
20 and 30 millennials
I feel like
do.
this is my wife talking to me right now.
Yeah, say 10 years since you've been to the dentist? If I could go 10 years without going to the dentist, it would suit me fine. Keep your mailing address up to date, and this is particularly for Medicare beneficiaries. The Social Security Administration maintains the database that sends letters out on behalf of Medicare as well as Social Security. And Medicare and Social Security work, they're two separate programs, but they work, you know, pretty much like this. So, and the reason for keeping that mailing address up to date is this, and this is a fraud prevention tip. Generally, those government agencies will never contact you by phone if you didn't call them first. So if you get a phone call, you can just about bet that it's a scam. If somebody wants to give you something, offer you a better deal than one of those, if it sounds too good to be true, it probably is. If they're selling something over the phone and they pressure you and they kind of imply that they're from a government agency, it's probably a scam. So keep that address up to date with Social Security is always a good step. And it's very easy to forget to do that now because Social Security checks, almost without fail, are direct deposit. So you may not even think about that until something happens. Only give your Medicare information to somebody that you have contacted and that you feel like is a trusted servant to you, has your best interest at heart. And for the most part, that means limit giving that number to your medical providers, hospitals, laboratories, and then places that you need to go to purchase medical equipment, pharmacy, places like that, and me, of course, if you need help. But trusted individuals, and just be very leery of giving that Medicare number to anybody. Because again, for the present, right now, that number includes a Social Security number, possibly of a deceased spouse, but definitely it was somebody's number at one time, and then you can end up being the victim of someone setting up a credit card account on your behalf if they've got a Social Security number that will validate all the way through the system.
Now, I don't want to rush you. We're just down to just about 2 minutes now, so I just want to make sure we get through all these.
Okay. Don't carry your Social Security card or your Medicare card unless you have a real reason for it. Doctors want it at the first of the year usually, but then you should put it away. And by 2019, we think that all those numbers will be replaced. People will get a new card. So we want to caution people kind of a little bit ahead of time now that don't become the victim of a scammer wanting to help you get a new Medicare card. Okay? And then just make it a rule to not give out any information to salespeople that you didn't contact first. Join the do not call list. It doesn't work 100%, but it's better than nothing. And then if you think you've been the victim of medical identity theft or Medicare fraud and abuse, contact 1-800-MEDICARE, contact your state Senior Medicare Patrol program, or you can call me. And we work together, West Kentucky Allied, Penny Ryle, and I all work together, and we make sure that people get started toward resolution of their problems. My number is 270-442-8993.
Okay. Ms. Kathie Hunt,
Yes.
thank you so much for being
You are
with us
welcome.
today. It was great.
It was
good
great.
information.
It's such a wonderful opportunity to encourage people and to get our message out.
Right. And I really appreciate all you've done over the years,
Oh.
of all the service you've had. So I
Well,
really
you
appreciate
too.
that.
You too. You've
So,
done a great job over the
anyway.
years. And I'm sure Andrew's got good days in front of him
Yeah, well,
too,
let's
and
hope
has
so.
already done well.
All right. I want to thank the audience for being with us today. Thank you for being here with Raising the Standard. We'll see you again soon.